Good afternoon, my name is Darren Young. I work with the UPCAP, the Upper Peninsula Commission for Area Progress. Part of my work is to do outreach for the MAP program, which is the Michigan Medicare Medicaid Assistance Program. So I do presentations on different Medicare plans. And you guys all look too young to know about Medicare and Medicaid, but when you get to 65, it can be very confusing trying to figure out what the best plan is. So that's part of my job, is to help inform people. Today's myth will be the fact that a lot of people are under the assumption that Medicare covers everything for free. That is not the case. For example, there's different plans in Medicare. There's Part A, Part B, Part D, drug plans, lots of different things, and that's part of the reason why it's so confusing. But for example, Part A, otherwise known as hospital insurance, has no premium attached if you've earned 40 work credits throughout your lifetime, which is about 10 years paying into the program. But most people still have to pay a premium monthly. However, Medicare Part B, which is outpatient service, has a standard premium. I think in 2016 it was around $120. Part D, which is a prescription plan, also requires a monthly payment. There's also co-pays on insurance. One of the top premiums consumers could be responsible for deductibles and out-of-pocket costs. There are no annual out-of-pocket limits with original Medicare, meaning that retirees are often responsible for about 20% of their medical expenses. And like I said, a lot of people think it covers everything. It doesn't. For instance, Medicare doesn't cover your standard dental, vision, or hearing care. If you're interested in these services, though, you may want to consider an all-encompassing plan, Medicare Advantage plan, or purchasing separate health insurance for these services. There's other things it doesn't cover, like out-of-country medical care, most cosmetic surgeries, which I think is a given. Certain types of diabetes supplies aren't covered as well for Part A and Part B. So that being said, the MAP program that I spoke about earlier, the Medicare Medicaid Assistance Program, is a program designed through federal funds to help people who are on the Medicare Medicaid plan get guidance. They have no ties to any insurance companies, so they're not biased. It's made up of volunteers who are usually, most of them are retired nurses, social workers, people that really just want to help others. And I think in the UP we have a great community for that. There's different MAP programs downstate, but when we hear about, or when they hear about what we're doing up here, they always give us a pat on the back, and they tell us that they don't see that kind of volunteer work downstate as much as they do up here. So it's just a great program. There's people that will sit down with you, and they go through extensive training on learning the different Medicare and Medicaid programs, the different prescription programs, but they'll sit down with you one-on-one or over the phone, and they'll look at your health needs, your prescriptions, and they'll show you 3 different plans. And like I said, they have no ties to insurance companies, so you don't have to worry about there being a hidden agenda. They're basically going to say, there's 3 plans right here that are going to benefit you. This one might cover co-pays on prescriptions, and for someone who has 30 prescriptions, even if your copay is a couple bucks, that adds up when you're on a fixed income. Or they might say, hey, this plan your doctor's not on. So some people don't want to lose their doctor. So it's just nice to have somebody who is knowledgeable that can sit down with you and give you free advice. Not necessarily advice, but they'll just show you the plans. They don't push a plan on you. You choose the plan you want. But every year we have people come to our office and sit down, and they save money. They find plans that they might save $500 a year, they might save $1,000 a year. And they didn't know about these plans because, like I said, Medicare and Medicaid can be very confusing. It's too bad that it is as confusing as it is. People should be able to understand Medicare and Medicaid. And if you don't have family that can advocate for you, if you have cognitive issues or memory issues, it can be very frustrating and stressful and can affect your health. So having a MAP counselor sit down with you and help you and give you that guidance, it's a really nice service. And like I said, they're all volunteers. It's a really great program. The way to contact a MAP counselor is to dial 211. Back here, I'm just gonna step away from the mic, I'll talk a little louder, my outdoor voice. I see some people have these bags, I'll pass a couple out, but I have information right here about a free Medicare training that a MAP counselor will be putting on October 3rd at the Lakeview Arena. So if anybody wants a flyer, or if you know someone who's turning 65 this year, this would be a great thing for them to go to. It's an educational workshop. It's about an hour, maybe 2 hours. There's free cake, because it's for people turning 65. And they don't have to be turning 65 like this month. It could be in 5 months from now. You know, it's just a great free workshop to go learn about Medicare. There's also some other things over here. We've got a Creating Confident Caregiver workshop that has nothing to do with Medicare or Medicaid, but there's a flyer on that, so if anyone's a caregiver or knows a caregiver, it's a free workshop. And then I also have a handout here for extra help programs in Medicare. So feel free to take any of those. And then I have a ton of bags here. Please take 1 or 2. It has Medicare information. It's got some chip clips, some pill caddies, a couple goodies. But there's a lot of really good information about the programs that UPCAP puts on throughout the UP. And this is a UP-wide program, so you don't have to worry about you've got friends or family in Hope and having them come down here or to Escanaba where I came from. We've got MAP counselors all over the UP. So I would really suggest contacting 211, telling your friends who are on Medicare, telling your friends who are turning 65 this year that this is a free service and it's just here to help. So, thank you. Try to 5 over 7 minutes.